Hi, everyone. I'm Elaine Quijano. It's good to be with you. Thank you for joining us. President Biden is ramping up efforts to get more Americans vaccinated. He outlined his short-term plan Tuesday to get the nation back on track.
We will increase overall weekly vaccination distributions to states, tribes, and territories from 8.6 million doses to a minimum of 10 million doses. Starting next week, that's an increase of 1.4 million doses per week. From this week forward, God willing, we'll ensure that states, tribes, and territories will now always have a reliable 3-week forecast on what the supply they're going to get. So they'll know 3 weeks ahead of time what's going to be there in the 3rd week. This is going to help make sure governors, mayors, and local leaders have greater certainty around supply so they can carry out their plans to vaccinate as many people as possible.
The president also announced that the federal government plans to secure an additional 200 million doses of the Moderna and Pfizer vaccines. The president's update comes amid a slow and chaotic vaccine rollout. More than 44 million doses have been distributed, but only 23.5 million have been administered. Some states say they're running out of doses, while others are holding on to some supply for patients waiting on a second shot. The administration admits it will be months before supply meets demand. But there is good news from the CDC about getting students back in their classrooms. New research suggests masks and social distancing may offer enough protection to reopen schools and resume in-person learning. Meanwhile, global coronavirus cases topped 100 million Tuesday. More than 2.1 million lives have been lost, and new variants of the virus are showing up around the world. Manuel Bojorquez reports from Miami.
In parts of the country, vaccine appointments are being canceled as states and cities like New York are desperate for more supply.
Right now, I need hundreds of thousands more doses per week.
Dr. Michael Osterholm is on President Biden's COVID advisory panel.
Was there a clear strategy?
Operation Warp Speed was a tremendous success with regard to making the vaccine, but there was no plans really put into place for how to move it into our communities.
Florida's governor today fought back against White House claims the state has failed to administer half of its vaccine doses, saying some are being held back to guarantee seniors get the second prescribed shot.
Because that's what the FDA has recommended, and so that's what we're following.
Well, that in a sense is a disconnect, because you surely don't need to hold all the second doses if you can count on vaccine coming next week.
There is hope for more supply. Johnson & Johnson is expected to release data on its single-dose vaccine in the coming days. And Regeneron, an antibody cocktail President Trump credited with his recovery last year,
I took something, Regeneron, it was, highly sophisticated stuff,
was found to be effective in preventing COVID-19 infection in a clinical trial. There's new research on infections in schools. A CDC report found little evidence of widespread transmission in schools and communities, provided mask and distancing guidelines are followed, but also found that indoor sports without mask use pose a danger and should be stopped. The news comes as more contagious strains of the virus are spreading, including one in California, where more than 37,000 have already died from COVID, 12,000 this month alone, including Jasmine Jacobo, who fell ill before Christmas and died January 13th. She was just 33 years old, survived by 5 children, now being cared for by her brother.
We've had uncles that are 70 years old that ended up in the hospital and came home. So we expected her to come home. The love that she shared with everybody was amazing. She was a beautiful person.
Those painful stories continue to bring demand for the vaccine into focus. Elaine, today the state of Florida announced it has vaccinated more than 1 million seniors so far and has started to set up appointments for second doses at this state-run site.
All right, Manuel Bojorquez, thank you. Dr. Amesh Adalja joins me now. He's an infectious disease expert and a senior scholar at Bloomberg School of Public Health at Johns Hopkins University. Dr. Adalja, thanks very much for being with us. Global coronavirus cases topped 100 million Tuesday. The U.S. makes up a quarter of those cases with more than 25 million infections. Remind us, doctor, how dire is the outbreak here in the U.S. at this point?
We're still not out of the woods. We have a very high number of cases occurring every day. We still have thousands of people dying. We have record numbers of hospitalizations. We've seen a little bit of ebb in the numbers. I don't know how sustainable it is, but it is something that we can be happy about. But it's really a very high level of cases that we have, and it's not going to be sustainable forever. This really pushes us to want to get this vaccine into as many people as possible, as quick as possible, because this can't go on forever, and we need to get this pandemic behind us. And I think it's important to remember that there's still going to be a lot of hard work, a lot of dark weeks that are going to be coming in the future before we get this behind us.
That being said, where should we focus our efforts?
I think the biggest effort really has to be on the vaccine. This is the solution that we have, and we have to approach this as kind of like a warlike effort with all hands on deck, with no speed limit. We have to accelerate significantly, even faster than President Biden is talking about. We want this vaccine to not be in freezers. We want it to be in people's arms, and I think we have to really pull out all stops and really not allow any kind of bureaucratic wrangling or fighting between federal and state governments to derail this process, because it is the way that we're going to get out of this.
So I want to dig into that a little deeper. Fewer than 23 million vaccine doses have been administered so far, and many states are running out. President Biden plans to increase shipments to states by 16% for the next 3 weeks and increase weekly vaccine allocations by an estimated 1.4 million doses. Is that enough, and what other obstacles are impacting vaccine rollout right now?
At the pace that we're going now, even with that acceleration, we're still going to be vaccinating well into the summer. It's going to take some time to cross that herd immunity threshold. But what we really have to do is figure out why this is failing in certain states. And we have to use federal assets like FEMA, the National Guard, the CDC to understand where states are, what the holdup is, and try and augment their ability to vaccinate. This is similar to what happened during the 2009 H1N1 pandemic, where there was a lot of confusion at the state level. So I do think this is going to be something that really is going to take effort, and we have to get this right, because people are suffering when those vaccines are sitting on shelves. And I think that we have to look at states like West Virginia and North Dakota that have done a really great job and learn lessons and pull best practices. But if you look at our country compared to Israel or Bahrain or the United Arab Emirates, we are woefully behind. And again, it's just another example of how flawed our pandemic response has been. And this should be unacceptable to the general public. We need to ask our policymakers to fix this and fix it now.
Well, Doctor, as states face a shortage of coronavirus vaccines, health experts say a second dose can be delayed. But I wonder, can waiting too long to get that second dose impact the vaccine's effectiveness? And what might happen if, for instance, someone was unable to receive that second dose?
So the Pfizer and Moderna vaccine are both two-dose vaccines, and that's how they were studied. That's how they were approved. We know that people get some protection after the first dose. Maybe 10 days later, they do get some protection. But we don't know how long that protection lasts, that it does wear off, and that's what that second dose is about. But you can get the second dose later, and that will give you the same benefit. But you will be left unprotected for some period of time until you get that second dose. So we want everybody to get the second dose. We want to try to keep people to that schedule. But unfortunately, because of our logistical problems, there are people that are going to have a late second dose and going to be unprotected for some period of time. But they don't have to start over once they get that second dose. They'll be able to just resume and get that protection when they do get that second dose. And hopefully the Johnson & Johnson vaccine, which is a single-dose vaccine, will eliminate much of this concern.
Meanwhile, 4 coronavirus variants have been identified. One was discovered in the UK, another in South Africa, the third here in the U.S., in California, and the latest one in Brazil. Remind us, Doctor, what we know of their mutations. How big of a threat do they pose?
So it's important to remember that all viruses mutate, and COVID-19 has been mutating since it landed in humans. And most of those mutations don't do anything. But what we've seen with these new variants, the UK, the South African, the Brazilian, and other variants, is some of them do have some changes in functionality. And what we're learning is that these variants likely do confer increased transmissibility, meaning you're more contagious with these variants than the original virus. So that really tells us we have to redouble our efforts to follow those common sense precautions of washing your hands, wearing face coverings, avoiding crowded and congregated places. And this is another reason we need to accelerate this vaccine to stay ahead of these variants. It does look like our vaccines are going to work. It may decrease some of those variants. Maybe the Brazilian variant may decrease the efficacy a little bit, but we've got a big cushion built into those vaccines. So hopefully we'll be okay. There's a lot of study going on, a lot of questions we don't have answered about all of these variants. But I do think it really, it doesn't change the way the virus behaves in us. It doesn't change the precautions that we have to take. So this really just is another example of what happens when you have unchecked spread, that these variants explode and then you have to deal with them. So I think the best solution to this variant is increased vaccination and continuing to follow those common sense recommendations.
Still have a long way to go in this fight. Dr. Amesh Adalja, doctor, thank you very much.
Thank you.